We are now retired, and I think it's a mean thing to do to the retired people of Australia who've worked since we were 16.
We all pay a premium for private health. Just this year it went up by 6.2% for the average consumer. But spare a thought for the over 50s. Theirs went up on average by 9.8%.
Given what we pay already in taxation, yes, it's a hard slug.
As they get into their older years, obviously things are going to go wrong. We need them to know, we need the government to tell them how much their insurance is going up every year.
But the average increase for over 50s is a figure not published by the federal government. Chairman of the 50 Up Club, John Mangos, says this is unfair, given they're the most vulnerable age group when it comes to health. He's now calling for greater transparency to encourage competition.
The national average is 6.2%, but mine went up 9.4%, and I didn't even know it. I mean, I got the extra bill, but I want the transparency so that I can shop around for one that went up less.
The national average published was 6.2%, but for the over 50s, this figure is misleading. If you fall into this age bracket, you could have been slugged as much as 13.7% more just in the past year.
Look, it's a nationally legislated figure. It's just an umbrella. And what we're saying is more information, please. Break it down. Tell us which companies are increasing their insurance by how much, so that people over 50 can have a look at 50upclub.com and go, you know what, I think I'll go for that company because it's a bit cheaper.
Clearly people over 50 are going to be bigger users of the healthcare system, but that doesn't necessarily mean that they should be paying more for healthcare. At the end of the day, a top-level cover policy is a top-level cover policy regardless of how old you are.
The 50 Up Club has launched a national petition hoping to put pressure on the government and in turn health providers. Tom Godfrey, spokesperson for Choice, says in the meantime research and compare your current policy.
There's no doubt that if you're over 50 and you're seeking private health insurance, there are real differences in how much you're going to pay for different premiums. So don't just auto-renew, find a policy that's right for you, because you will save a great deal of money.
Join the petition so that we can drop a big bunch of paper on the Health Minister's desk and say, do something about it.